and welcome to The Truth About Heart Disease. This is Dr. Dwight Lundell. I'm delighted to have you with us. Anita writes, I have a neighbor who told me her husband was only taking one drug, a statin. And besides being a brilliant physicist, he loved to mountain climb for exercise. On his last climb, he died suddenly of a heart attack at age 43. That shouldn't have happened. What is your thought on that? That's really a sad and tragic story. To lose a young, brilliant man at age 43 who had been given false hope that taking a statin would prevent his heart disease or his fatal heart attack. This man, like many others, had his first symptom of heart disease with a fatal heart attack. The mechanism of this is a plaque that built up in the artery but was not causing a reduction in blood flow to his heart muscle until it suddenly ruptured, totally occluding the blood flow. There are things that would have helped him, but statins weren't one of them. Give our sympathies to your friend. Dr. Schmidt writes in, I think the big reduction for inflammation is diet, weight loss, and exercise, which also reduces blood pressure and metabolic syndrome. Dean Ornish's study, which is the only real study for reversal of lesions, showed that LDL levels were far above what is coming out of the Cleveland Clinic that loads everyone up with statins and saying that LDL has to be below 60. Thanks for your interest, Dr. Schmidt. I don't know your specialty, but you're absolutely correct that the control of inflammation basically begins with diet, weight loss, and increased levels of activity. And indeed, those do things. And indeed, reducing inflammation does lower blood pressure, metabolic syndrome, and many, many others. Cleveland Clinic and many other cardiology centers continue to focus on lowering the targets for treating cholesterol. They're looking for LDL levels now below 60. Industry has very cleverly done studies. The most famous one lately was the TNT, or treating new targets, attempted to demonstrate that lowering the cholesterol levels even lower would bring more benefit. Once again, the evidence is very shaky, and I agree with you, Dr. Schmidt, and I agree with Dr. Ornish, at least on this small piece, that reducing the LDL to these levels is not beneficial and is probably harmful. That's all of our questions for today. I'm looking forward to our next session when we can answer those questions that your doctor won't. Good day. This is Dr. Dwight Lundell.